everyone. I'm Dr. Ellie and I heal kids. And I am here today to talk to you guys about holistic newborn care. And it may surprise you guys to know that as a pediatrician and a holistic pediatrician, I think of optimal infant health as starting in the gestational period. So when the baby is still in the womb. And maybe it would help to first kind of start with what in the world is holistic newborn care? What is holistic care in general? And then we can kind of move on and talk about what does this mean for the birthing parent and what does this mean for the newborn? So to start with, holistic care is a patient-centered approach. It's a way to consider, emotional health, physical health, social health, and spiritual well-being all in one because, as humans, as patients, all of these types of health are connected. It's not that our mental health and our social environment is separate from what's going on within our bodies and what symptoms we're getting. It's all, contributing to the milieu of what's going on in the body. So it's important to consider all of those things. And, holistic providers may consider using a variety of therapies from, your traditional medical systems. So whether it's someone that you're seeing for Ayurveda or Chinese medicine, in my case, I combine conventional healthcare, conventional Western medicine with mind body interventions, with biological therapies, with energy, with dietary, exercise, nutrition. I can refer out for acupuncture, infant massage, yoga, all of those things. What else? Botanicals, the whole slew, right? So holistic health is referring to including all of those modalities in one. And that's why my practice is called Middle Path Integrative Medicine, right? Because I'm integrating all these different techniques into regular conventional medicine. So we're not leaving anything on the wayside. By the wayside, we're actually going to go ahead and utilize everything that we have at our disposal. So like I said before, the importance of starting prenatally, right? We want to start, infant care and infant health during gestation as much as possible. And so, it's helpful for the birthing parent to start kind of addressing some of the environmental things that can impact newborn health. And, what might that be? It might be stress. It might be nutrition, maternal physical health. So, making sure that, we're getting good prenatal care and what can we do to address relaxation? How can we support that birthing parent so that they are able to grow this human being in a way that is as stress-free as possible, and we're not passing down that stress through epigenetics to the baby or the fetus. So, you might consider, is that birthing parent, are you guys getting enough support? Are you able to socialize when with people that make you happy, with people whose eyes light up when you see them? Are you able to, be present in a work environment that's non-toxic to you? Are there ways to address those things? And then not to be forgotten, of course, nutrition. Many of us know that we should be taking a prenatal vitamin when pregnant, but there's also a few other things, right? We want to do folic acid, we want to do omega-3s, and for people with, depression, anxiety, it could be helpful to do some of those amino acids like tryptophan and tyrosine. So those are some supplements to consider, during the gestational time as well. A little word on supplements. So, and I have done this, right? I have done this where I am not eating the best, or I have had a moment where I am not drinking water, or I had sugar, and I will then be like, okay, well, I'll just take my supplements, right? And so that is not the best way to approach things, right? Because we want to have the base be the nutrition, right? So as much as possible, We want to focus on those healthy organic foods free of toxins. We want to make sure we're getting plenty of vegetables, more than fruits, although fruits are good too. Healthy proteins, healthy fats, and, also keeping some balance, right? So everything in moderation, and everything congruent. So we want everything to come together in a very balanced way nutritionally. And that can be helpful to, talk with your OBGYN, your midwife, or, another holistic provider about as well. We touched on stress reduction techniques for birthing parents. I think sometimes people will think of like yoga, which I love, by the way, and there are some amazing yoga classes in town. In fact, if you want to see Paulina Shaw over at West Asheville Yoga, I highly recommend them. They are amazing, and they have a wonderful prenatal yoga class over there at West Asheville Yoga, so couldn't recommend more. But there's other things we can do as well, right? So it might be that you want to take a walk in nature or listen to relaxing music or fun music, something that you can dance to, something that takes the stress off. You may want to do some meditation, or even you make sure that you're getting community support by getting out. If you're an extroverted person and you feel restored being around your friends and family, getting out and making sure you're seeing all of those people. Also connecting with other pregnant moms, right? So, maybe you want to join, a class or something where there's other pregnant birthing parents. And there's a lot of evidence for this, that reducing stress prenatally can help increase the health of that baby. So really important. Okay, the next one, you guys, toxins. So it is very difficult to avoid a lot of toxins, right? Because they're kind of ubiquitous in our environment. But as much as possible, let's make sure that we have a really good water filter, that we are avoiding BPA, phthalates, parabens, all of those things that you can find in cosmetics and in, household products. We just want to make sure that we're using something really clean. And another toxin a lot of people don't think about is air pollution. And, of course, we don't always have control over that. But if you do find yourself, for example, taking a walk and you're noticing a lot of traffic with fumes from the tailgate and that kind of thing, then you might want to look into, moving your walking location to somewhere without that air pollution present. So air pollution is a good one to touch on. Nutrition, of course, we want to try to eat organic as possible to reduce toxins. And then those environmental products as much as possible, just reducing those as well. The next one is planning your birth. So most birthing parents have thought about this. But if you haven't, this is an important one to touch on. This would be a great time, gestationally, to get your midwife, to get your doula, to get your, postpartum doula, whatever it may be, to create a supportive birthing environment for you and your soon-to-be newborn. And so there's a lot of people in Asheville, actually, that do this great work. The doulas over at Homegrown Families are amazing. Paulina Shaw, who I already mentioned, does prenatal yoga in Asheville, and also they have an amazing doula practice as well. And over at Lilac Birthing Center, if you guys are interested in the midwives over there, they're fantastic. They have a great facility. Every time I've been over there, they've been very friendly and helpful and extremely supportive. And then I've had patients over at Mayheck in Asheville. For people that don't know, they also have a great midwife program as well. And so making sure that you have all of these people in your world, in your bubble, to support you prenatally, postnatally, which is extremely important, you guys. Some people do forget that, but I couldn't recommend it more. If you don't have a lot of family support, or even if you do, getting a postpartum doula, especially in that first month, is just extremely key to, in my experience, mental health. Not everyone needs it, but I strongly recommend it, because that first month of having a newborn is extremely tiring. It is extremely stressful. And having someone that can show up for you and be present with you is extremely helpful to get you through that first month, especially when you feel like by week 3, you just, you may feel like you're never going to sleep again and you just need someone to show up for you. So I couldn't recommend, more, in this gestational time, go ahead and interview these people in your community that can help. Make sure that you're asking all of the questions that you want about their values and how they can support you during the birth, so that you can have a healthy newborn experience. Okay, what else? Emotional support. So we kind of touched on that earlier, but again, I couldn't recommend more. Go ahead and make sure that you do have friends, families, prenatal people, pregnant people in your life who you can speak to about this experience and what you're going through. And ask family members, are there ways that they can help contribute holistically? Maybe they can help by offering to make some food while you're, pregnant and gestating or during the newborn period. Maybe they can help find you that water filter. Maybe they can buy the organic newborn clothing or the vitamin D for your baby, these types of things, so that you're not having to run around and do everything yourself, because it's really important to ask. And I think in this society, oftentimes we're sort of trained to think, oh, I should be able to do it all myself and have it all together. But no, the reality is it does actually take, a village to raise a child. People can do it alone, of course. There are amazing people that are able to do it by themselves. However, I do think it's a heck of a lot easier when you do ask for support. And if you don't have family support, again, I couldn't recommend more if you have the budget, engaging doulas and midwives. If you don't have the budget, engage friends, engage family, because those people can really help you. And by the way, if you feel like that having people around you would be a negative experience in some way, it is absolutely 100% okay to say, you know what, I need the first, for example, 30 to 40 days alone to bond with my baby. That is also completely fine. So know that you do have the ability to say that as well. Let's see. Other things you can do to bond with your baby while you're pregnant. Definitely talk to your baby. Definitely listen to music. And here's one that people don't often think of. So positive affirmations. So it may sound a little silly, but sometimes just talking to your baby in a positive way can really help you bond and really help the baby to kind of calm in the womb as well. So try all of those techniques. So postpartum planning. Now, I'm a pediatrician, so I'm very familiar with the need for postpartum planning. Sometimes it just so happens that people get very busy, or, it slips their mind that they might need a pediatrician, and the baby's born and they're like, oh gosh, now I do need a pediatrician. And they're kind of scrambling, trying to find someone, and they may not be able to find someone who aligns with their values or, goes ahead and can get them in quickly, can answer their questions, do all of those things. So during the gestational period, the time that you're pregnant, I definitely recommend reaching out to pediatricians and seeing, who would be a good fit for you. And so if you don't know, I do have a practice, Middle Path Integrative Pediatrics, here in Asheville, North Carolina. And I take care of children 0 to 21 using holistic pediatrics. And I also take care of people 2 years old to 102 years old for functional medicine consulting, which is a different way of taking care of people as well. So if you need any of that, definitely reach out to me, or if you think it might be a good fit, I would be more than happy to schedule a complimentary meet and greet with you and tell you more about myself and my practice. Now, what is important as far as finding a pediatrician? What do you need to ask? I think this is a question that I get a lot, interestingly. How do I even know if I have a good pediatrician, right? Or might have a good pediatrician if you're interviewing somebody in advance. And I think it's really important, along with all of those questions that, people have along, what training do they have? What training does your pediatrician have? Are they holistically trained? Did they go to a 2-year fellowship in integrative medicine? Did they go on and do a 1-year mentorship in functional medicine? Are they an osteopath? Can they do body work? Those are all really good questions to ask about training. And then, normal questions, the office hours and blah, blah, blah. And, all of that. You want to know when the pediatrician's available and all of that good stuff. But one thing I think people often forget to ask is, does your pediatrician or expectant pediatrician align with your values? So are they kind? Are they in it for the right reasons? Are they here to help serve children? Are they, are they to the point in the career that they're just exhausted and burned out and they're not really that available? Are they holistic? Are they vaccine friendly? Are they inclined to give an antibiotic even when not necessary? What is the practice approach? And so I think it's really important to ask these questions about, does this pediatrician align with what I'm looking for? Am I looking for a holistic approach? Is this pediatrician holistic, or, will I end up battling my pediatrician? Because that is not a relationship, that anyone wants, where they're kind of battling their provider and clashing because their values are just, completely different. So do make sure that you ask about that. And another thing I would ask is how the appointments work. Not only what is the length of the appointment, but also what happens, right? So if the length of the appointment is 30 minutes, but 10 minutes of that is seeing the medical assistant, 10 minutes is seeing the doctor, and 10 minutes is seeing the medical assistant again for, wrapping up the visit, getting medications if you're choosing to vaccinate, vaccines, all of those things, you may actually be only seeing that pediatrician for 10 minutes. And that is very different from, for example, like in my practice in middle path, the way that I do care is that I give you guys an hour and a half with me personally, to get down to work and make sure that we get all of your needs met in that hour and a half appointment for your first newborn visit. And then, of course, all of the follow-ups from there are 45 minutes long. And during that visit, I'm able to do osteopathic medicine, functional medicine for ages 2 years and older, integrative medicine, regular conventional pediatrics that you just might expect from any, pediatric practice, such as your well check, your sick visits, all of that is included. So here at Middle Path, where I'm very holistic and I get down to work and spend the time with you guys that you need. Okay. And so what else postpartum? So now you've got your pediatrician. What else do we need to consider? Well, if the birthing parent is able to breastfeed, breastfeeding support, right? So do we have a lactation consultant if necessary? Do we have herbal support and natural remedies for, breast pain and nipple pain, for milk production, all of those things? Are we able to have a good relationship with the pediatrician, such as we can say, we're needing support around if there's any postpartum, anxiety or postpartum depression, anything like that. And so we really need to make sure that we're supporting birthing parents during the postpartum time, and also addressing nutritional needs, hydration needs, breastfeeding needs, and helping with emotions and mental health as well. A little more on breastfeeding. So we do want to make sure that, if you're not able to breastfeed for some reason, that you are aware of, what are the safe formula choices, what are, some integrative feeding strategies that you can use instead of breastfeeding as well. Another aspect in newborn care would be creating a gentle sleep practice, right? So learning how to create a calming environment for your child. And in fact, there's a lot of research on this, right? How can you create an environment that feels peaceful, the energy is calm, that is conducive to healing and conducive to rest, and that supports natural sleep rhythms? Those are extremely important as well. And then learning how to soothe your baby, how to calm a fussy baby. So infant massage can be great. Taking deep breaths while holding your baby can be amazing. Gentle patting, stroking can be amazing. Sometimes rocking movements, walking around the home, car rides, all of those things can be really helpful, as well as white noise and generally having a good restful environment. Beyond that, we also want to look at newborn care. So, how can we build strong bonding with skin-to-skin contact at birth through breastfeeding if possible, using probiotics if needed, using vitamin D, and again, avoiding all of those harmful environmental exposures, right, in the water, in the air, in those products that, you may be buying. It's always good to check the ingredients as well. And then a little later on, some of the other things we're going to want to look at would be, holistic safety and childproofing. So again, the non-toxic environment, non-toxic products, cleaning agents. How can you use an herbal balm for diaper rash? What are the natural soothing techniques for colic? What are the dietary considerations for breastfeeding moms? How to support secure attachment through, different things such as baby wearing. How can we improve the holistic environment of the newborn? And probably not lastly, but the last thing we're going to talk about in this podcast today is integrative pediatric care. So scheduling those routine checkups are so important, right? So normally, if for those of you that don't know, your newborn is seen in the first few days of life. So generally, it's within 2 to 4 days of life by the pediatrician or midwife, if you're using a midwife for that particular checkup. And then again at 2 weeks old, sometimes 1 month, 2 months, 4 months, 6 months, and it goes from there. So getting all of those routine checkups are really important so that your pediatrician can monitor nutrition and growth and development in your baby, and also monitor the family dynamic, right? So making sure that the birthing parent isn't experiencing any postpartum anxiety, depression, PTSD, which, by the way, can also occur in the non-birthing parent as well, due to many things, for example, a NICU stay or just loss of the life that they once had and then transitioning into this new life. So it's important to bring all of those factors together because this is, pediatrics, in my opinion, is a family event, and it's very difficult to separate a child from the family and understand health in that way because health is connected. We're connected to our community, and our community starts with, for most children, their immediate family. So very, very important to schedule your routine checkups with your holistic pediatrician. And then, building that holistic family support. So we do want to make sure that, if you're not wanting to do a 30 to 40 day sort of homing in with you and the baby, if you are wanting to kind of get out more, that you're able to access parenting circles and community groups and places where, postpartum people are, because oftentimes those first few months can be particularly isolating. If you weren't planning to stay home with your newborn, maybe you currently are and you've taken time off from work. And so your social circle at work has diminished. And then, you've got this kind of wacky sleep schedule. So it can be hard to meet with people. And sometimes that can be a little bit depressing or anxiety producing. So it's really important to, if you can, make sure that you can connect with community groups, parenting circles, and holistic practitioners that can support you, as well as family members and friends as well. So that's a little bit about holistic newborn care. There's so much more that we could talk about. We could go on and on and on. And any of these topics, in fact, could be an individual podcast. And maybe that's what I'll do in future, is break these down a little bit more for you guys. But if you did like this podcast, go ahead and subscribe to it. I would love to have you do that. And if you do need a pediatrician, a holistic pediatrician, please reach out at middlepathintegrative.com. You can click on my website and get your complimentary meet and greet. I would be more than happy to take care of you and your baby or children or child. All right, guys. Well, that's enough for me today, and I'll see you in the next one. Wishing you well. Bye-bye.